and I am a master's student at Trinity College. I studied mechanical engineering for my undergraduate degree, and now I am doing a bioengineering master's specialising in tissue engineering. A large portion of my master's surrounds a research project which is based here at Trinity Institute for Bioengineering. Is a major issue worldwide. Surprisingly, it's the second most common complaint after the flu. In 2010, here in the Republic of Ireland, approximately 395,000 adults were diagnosed with lower back pain. And by 2020, it is predicted that this will have increased by 15%. The primary instigator of back pain is believed to be degeneration of the intervertebral disc. So the IVD can be compared nicely to a donut, made up of an outer fibrous ring known as the annulus fibrosus, and this surrounds a hydrated gel-like structure known as the nucleus pulposus. With degeneration, the hydrated gel-like structure loses functional cells and water and becomes dehydrated, causing the disc to lose its shock-absorbing capabilities and causing pain to the patient. So at the moment, the only cell-based therapy to address intervertebral disc degeneration is autologous disc cell transplantation. This involves taking cells from a patient, expanding them in the lab, and injecting them back into the patient. There are, however, issues with this approach. Firstly, the intervertebral disc has a very harsh microenvironment of low oxygen, glucose, and pH levels, which the cells are not used to being subjected to. So there are often issues with cell death, and the cells also tend to leak away from the site of interest. So, if we could encapsulate the cells in a biomaterial, it will provide a protective niche for the cells from the harsh microenvironment of the IVD. Encapsulation of cells in a biomaterial is not difficult to achieve. The challenge, and in fact the goal of this project, is achieving this at a micron level, so the therapy can be delivered in a minimally invasive manner. So the goal of my project is to develop a technique to microencapsulate cells in a biomaterial using electrohydrodynamic spraying technology. There are 3 stages to this process. Firstly, the cell expansion period. This involves thawing nucleus pulposus cells which have been isolated from porcine discs. These are transferred to tissue culture dishes, and then they are incubated. The second stage is microencapsulation of the cells in a biomaterial using electrohydrodynamic spraying. Alginate is a natural polymer used in many tissue engineering applications. It is combined with the NP cells to form a homogeneous mixture. The mixture is then placed in a pressure vessel belonging to the electrosprayer. Calcium chloride is a crosslinker for alginate. This means that when the alginate solution comes into contact with calcium chloride, it turns into a gel state. So the calcium chloride is added to the collecting dish. A voltage and a pressure are applied. This causes the alginate cell solution to pass through the tubing into the needle. Due to the voltage at the tip of the needle, a jet of micron-sized particles is formed. When these particles land in the calcium chloride, micron-sized spheres with cells encapsulated in them are formed. The last step involves collecting the microspheres, resuspending them in media, and culturing them over a 21-day period. So the technique of encapsulating the cells in the alginate biomaterial provides a protective niche for the cells from the harsh microenvironment of the IVD, and it prevents the cells from leaking out of the disc. The added benefit of using the electrohydrodynamic spraying technique shows the potential of this technique as a therapy for minimally invasive repair of the intervertebral disc. Minimally invasive approaches have advantages to everyone, in particular for the patient, the doctor, the healthcare system, and to the patient's employer.